Bienvenue dans ce format short du podcast Healthtech in Progress, format que je produis en partenariat avec l'ACIP Santé, l'association des cadres des industries de santé. Ce format short est un format plus court dans lequel je reprends un épisode passé et dont j'extrais les éléments les plus pertinents, les plus intéressants. Et dans cet épisode, j'échange avec Fredrik Debong, mon premier invité étranger. L'épisode sera donc en anglais, mais pas d'inquiétude. Fredrik est le fondateur de hi.health, une solution qui simplifie le remboursement des soins par les assurances privées. Mais surtout, Fredrik est l'ex-cofondateur de mySugr, l'application de référence pour le suivi du diabète, qu'il a vendue à Roche. Dans cet épisode, on reviendra donc sur son épopée avec mySugr et sa passion pour l'entrepreneuriat Healthtech. Bonne écoute à vous.
So I'm very interested about your journey with mySugr. What's your story with diabetes?
Oh, I live with it. So in 1984, I was diagnosed with type 1 diabetes, which means you have to take insulin the rest of your life. That's how the therapy works nowadays. It's a very data-driven therapy. And so after having that disease for nearly 30 years, I realized we could do something about it by making mobile diabetes management easier to do using mobile apps, make the data speak to you in day-to-day life so you don't have to think about everything all the time, right? But we added a hint of positive psychology there too, to help keep people keep motivated to take care of themselves. And with time, mySugr grew into being integrated with many blood glucose devices and now also insulin pumps. It was from day one a medical device application, the first FDA and CE marked app out there. Over time, we even saw two of our customers tattoo our logo, the little green monster, on their arms. I mean, it meant it really had an impact for them.
Do you think it's important to be concerned, to be touched directly by a pathology when you start a business in healthcare? Or
personally, believe is an extremely strong motivator, but it doesn't have to be. You don't have to live with a disease to be passionate about solving problems in it. If you're in love with a problem, you don't need to live with a problem, right? Many of my friends in diabetology are leading diabetologists who have fallen in love with the field and the impact they can have. They don't necessarily have to live with it, right?
For you, it was not too hard to leave a project after 7 years of developing it from the beginning?
It was really hard.
How do you live? How do you feel at this moment when you sold your company, your first company?
Proud, of course. And the company we sold to, Roche, is one of the market leaders in this field, right? They can now take the ball and run, right? The impact we had with mySugr was tremendous. But with Roche behind them, a multi-billion-dollar company, the impact is going to be even greater. But there comes a time when you have to realize that, you have limitations. And I've come to believe about myself that I'm good at imagining things and making them become reality. But once they're there, I want to jump on to the next thing. And with that insight about myself, the company grew to nearly 200 people before I left. And mySugr, 250 people now work at mySugr in San Diego and Vienna. It's a fairly large operation now, and it's doing fantastically well. I was leading parts of medical risk management, market surveillance, vigilance, what else? Data science, research and development, a number of other topics too. But, as a founder, your job is really to replace yourself, to fire yourself from every role you can find, right? Or you find yourself in. So that took a while to find the right people for it. But once that was in place and my baby was doing well, I moved on.
And how are the first contact made with Roche?
Oh, we so I think back in 2012, Yeah, back in 2012, we met the head of Roche Diagnostics and diabetes care for here in Vienna, because he went through Vienna once a week. Every week, more or less, he traveled around the world to every country he was heading up. And we met for an hour, became 2-3 hours. And then we met the steering group, more or less, of Roche Diabetes Care in Mannheim. And in 2017, we entered into an agreement where, no, actually 14, we entered into an agreement where we integrated with their device and started offering it to people that they could also subscribe to blood glucose test strips for it. So it became like a bundle, we called it. So we started doing business in 2014, and 3 years later, they acquired us.
And how are the negotiation going? Is it hard? Is it easy?
It was exciting. There were a few days when it was two of our co-founders sitting across the table from 15 lawyers. That was kind of exciting, right? Yeah, that was exciting.
Okay, so now we are going to talk about hi.health because it's what you do now. First question: why did you want to re-enter the business so quickly after selling mySugr?
I found a problem, not just a personal problem I live with, but one which has a tremendous negative effect on the world. And I found that about the same time that we sold mySugr, actually. I started thinking about it with a friend, and realized that after about a year after exit, I realized I really want to do something in this space to solve this problem. And that's why I left.
Okay, so what's the purpose of hi.health? Can you explain us how it works?
Absolutely. In many parts of the world, the healthcare system is built up based on private health insurance. I don't know if you love insurance just like everyone else. We don't generally. But the concept of insurance is beautiful. We distribute risk. If you and I like each other and want to see to it that if you have an issue, then that you don't go bankrupt, then we both sign an agreement and start like putting money aside for a rainy day. And if you have a rainy day, you can tap that budget, right? That money, that hoard of gold, right? So it makes sense. Distribute risk. Simple. But in many parts of the world, we have a private health insurance system, which often requires you to pay yourself first and then get reimbursed for it. And it turns out that this hinders access to healthcare for people. If you have to pay yourself for the insulin pump and the services you need to be able to access an insulin pump, that's 8,000 euros. Or a CGM system like I'm wearing now, which measures my blood glucose in real time, all the time, right? That's 3,000 euros out of pocket that you have to pay first and then get reimbursed.
It's a bit different in France, I think.
Yeah. Every country is different. In many parts of the world, private health insurance is what you can get, period. But in others, we have a public health insurance system or a private health insurance system which is well integrated. But if you look at the EU, it turns out that nearly half of our population feel burdened by their healthcare budget, by their health expenses, and 11% feel significantly burdened. If you look into these statistics, you find people like my parents, people like my family with 3 children, and people like me with chronic conditions. And we feel the burden bluntly in our lives. If you live with a cardiovascular issue in private health insurance, you're out of pocket more than 12,000 euros every year. That's what you pay and then have to manage to get back from your insurance. There's so much else that is more important than this artificial hurdle. It's artificial. And that's what bothered me. Nowadays, we have N26, we have Klarna, we have PayPal, we have eToro, we have one-click buy on Amazon, right? But in healthcare and health insurance, we're slapped in the face and we're unable to access what we need, and it's artificial. So what we set out to do was remove payment from healthcare. Simple. To do so, we had to integrate with insurances, become insurance brokers. We had to set up banking infrastructure in the background to be able to allow you to be able to submit reimbursement requests
Okay.
for people in Germany. That's where we currently act. And then with the banking infrastructure in place, we're able to cover the expense for you. So when you get a bill from the doctor of, say, 2,000 euros for whatever it was, right? Take a picture of it and we take care of it for you. You don't have to pay yourself anymore. We do that. And then we get the money back from the insurance. And now, slowly, in the next few weeks, we are launching an online checkout system where we cover the expense. So instead of you paying in the online pharmacy, we pay for you and get the money back from your insurance. So you're no longer burdened by the financially. You no longer have to manage the cash flow, and you have no work anymore. That disappears. A checkout without payment. Simple.
Another question, because I'm very curious about it. What was your first action when you decided to launch hi.health?
This company I'm building together with an old friend, Sebastian. And Sebastian and I lived together for a month when we were students. We've always been talking about doing something together. Now, finally, we're able to. So, our first action when we decided, I think we opened a bottle of wine and celebrated together.
Okay. It's a beautiful first action.
Yeah.
Another tricky question. What fund did you start hi.health?
I already sold one company, so I had access to money. So I invested in the company and we started it up. But it took about a year and a half for us to build the product and put everything in place. Now we have a lot of backers behind us. We have nearly 20 people who have invested personally, business angels from medtech, from pharma, from insurances, from every field you can think of, everyone focused and understanding this problem. We then brought on board friends of ours from Italy, Healthware Labs, and we brought on Seed Camp, and we brought on Speed Invest and Pacific 8, and a lot of venture capital companies that wanted to join us in this journey. Now we're nearly 30 people working out of 4 countries, and seems to work.
It's very, very quick.
Yeah, we had the option to let it go slower, or we could go faster.
Do you already have a business model with hi.health?
Of course. My co-founder was formerly with McKinsey and has a PhD in game theory focused on business. Yes, we have a business model or 10. But what we are building, this change in the healthcare system, using fintech on top of health insurances, it enables us to build a tremendously big business. But first, we need to get the numbers up there. So now it's for free for everyone, up to 100 euro. We cover the expense for free.
Okay.
And soon we will be covering more, bigger expenses too. But for that, we'll take a slice of the pie.
So regarding what happened during the pandemic, do you think everything is done about digital health, or do you think there is more to do?
Oh, there's always more to do. So the pandemic was like what do you call it? The knighting of digital health, right? Suddenly, telehealth and digital health have become reality, right? Where earlier we were playing around, now it's here. We have companies like Kry and Babylon, mySugr and Teladoc. It's digital health is here now, finally. But there's so much to do still. We've been able to help the FDA and EMA set up an easier process to get approvals. That's done, right? We see in Germany methods of reimbursing digital health services starting to be rolled out. Still very immature, not perfect, with a lot of bugs, but it's becoming reality. The potential to deploy digital tools for managing and diagnosing and taking care of disease, of therapy, it's fantastic. It's taken seriously by now. 10 years ago, walking up on a stage in a medical conference, The stage was the smallest one they could find. Now you're holding the keynote. So the medical field, the medical practitioners are taking it seriously and actually putting a lot of effort into understanding and trying to and giving it to their patients. So the field has matured. What I see now as the biggest hurdles is access, education, and for digital health to become an entrenched part in the ecosystem of services offered to patients, where I see huge opportunity for big pharma and medtech, where a lot is changing due to digital services, that they have people on the ground. They can become educators for healthcare professionals, hospitals, and clinics, telling them about everything that's new out there. Because as a physician, you don't have time for it. You don't have time to look into the new diabetes app out there. You don't have time. You have thousands of patients that expect more and more of you. It's harder to manage than before.
A lot of choice.
Yeah, a lot of choice and, a lot of uncertainty. And I believe that if the ecosystem, as in big industry, together with Diabetes Association of Germany, for instance, come together and start educating physicians in their clinics and hospitals about digital health, then we'll also capture the next wave. I think that needs to happen next.
And to finish, I have a few questions and a big one, a very big one. What was your biggest failure in your entrepreneurship background?
Not realizing that the job of an entrepreneur is to fire themselves. As an entrepreneur, you need to get rid of yourself. You're building a company. You're not building the product, which means you need to find experts in the fields you believe you are good at, because you generally suck at most things you do. Replace yourself. You're building a company, not a job.
How many times did you take to understand this?
I'm still learning it.
And with your experience, do you have an advice for those who want to start a business, to start a company in healthcare?
It's simple. Love the problem you're working on and see to it, like we are so luxurious in the field of healthcare that we are focused on one of the most important things there is, life, health. So love the problem you're working on, because the solution always changes. And see to it that you can take a step back and connect it to bigger things than just the app you wish to build, right? So be passionate about what you do. Otherwise, you're going to burn out and waste years of your life. Wow.
Thank you for this answer. I think I can record it for the last sentence.
It was wonderful. So thank you so much for the conversation, Maria Dick.
So that's the end of this episode. I hope you enjoy it. So feel free to subscribe to the podcast and give it a 5-star rating. See you next week.